My name is Terry Mamounas. I'm the medical director of the Comprehensive Breast Program of Orlando Health UF Health Cancer Center in Orlando, Florida. When it comes to identifying patients who have contraindication for breast preservation or lumpectomy, the reasons can be divided into either absolute and relative contraindications. However, even the absolute contraindications can be looked at as relative for a variety of reasons that I will outline. So the absolute contraindications include, for example, having multicentric disease in the breast. Let's say somebody presents with 2 breast tumors in different quadrants. Traditionally, these patients were not candidates for breast conservation. But if a patient has sizable breasts and the tumors are clearly apart, and you do like an MRI that shows that there is no multicentric disease except the 2 areas, and cosmetically you can remove those 2 areas and give postoperative radiotherapy with good cosmetic result, that's not an absolute contraindication of not doing breast conservation, of course, if the patient desires to do that. Probably the most absolute contraindication is having diffuse suspicious microcalcifications in the breast, because that occupies a large area in the breast that you cannot really get around with reasonable cosmetic results. For those patients, we recommend usually mastectomy. Of course, also the inability of obtaining clear margins after lumpectomy can lead to an indication for mastectomy. For example, after you do the first re-excision and maybe a second re-excision, and you can still get positive margins, at some point you have to quit and say to the patient that you probably will get better cosmetic result by having a mastectomy with reconstruction than multiple lumpectomies that will deform the breast. Also, first or second trimester of pregnancy is one of the contraindications for surgery in general and for breast conservation as well. Most important in breast conservation because radiation needs to follow. But nowadays, with adjuvant chemotherapy for the majority of the patients, you can even do breast conservation and then give breast radiotherapy after chemotherapy. So you can give chemotherapy during pregnancy and then do the radiation after the patient delivers. So that's also to some extent a relative contraindication if you can give the radiation after delivery. Having history of therapeutic radiation to the region is one of the absolute contraindications. But again, here, if the radiation has been given many years before, somebody has the radiation as a teenager and develops breast cancer in her 40s, sometimes the radiation could have been given for acne or for Hodgkin's disease in the breast area. That patient could potentially have repeat radiotherapy if she so desires. But there's some limitations on how much dose was given and how much dose can be given again. Some of the relative contraindications include having large tumor size to breast size ratio for acceptable cosmesis. In other words, if you have a large tumor but a small breast, it's difficult to do it with good cosmetic result. However, even for these patients, we can offer them neoadjuvant chemotherapy to shrink the tumor and potentially perform breast conservation if they are desirous of that. Having a history of collagen or vascular disease is a relative contraindication. Some of those patients can receive radiation, some others may not. And obviously the radiation oncologists have to weigh in on that. And if the radiation oncologist says, well, this is collagen disease that doesn't allow for radiotherapy, then we'll usually do mastectomy. Also, tumor located beneath the nipple is another contraindication. But again, in those patients, sometimes if the breast is large, we can do a central lumpectomy where we remove the nipple areola complex, but we leave the breast mound. So the patient has good volume, and then the nipple can be reconstructed again later on. And on the other side, you can do a symmetrizing procedure. So even that is not an absolute contraindication. And lastly, in some places, there's unavailability of radiotherapy. In the US, it's not a major issue because most patients can get to a radiotherapy facility within a few miles. But if, let's say, in a place there was no radiotherapy, then mastectomy may be a better choice because with lumpectomy, we do like to follow with radiotherapy. So these are some of the reasons why we don't do breast conservation.